And welcome back. Well, for people who suffer with chronic sinus infections, it may seem like that never-ending merry-go-round of doctor visits, surgeries, medications, and then things don't always get better after that.
It's very frustrating. Dr. Madan Kandula is a board-certified ear, nose, and throat specialist from Advent. He is here to talk about a way to get off the merry-go-round once and for all. Great to see you.
Yeah. Great to be here.
Yeah, I think it's for people who have any sort of chronic condition like this, they just get used to it and they just keep doing what they can to relieve some of the symptoms. So let's talk about some of these chronic problems and why it is so, in your opinion, that so many people are still just suffering sort of needlessly.
You know, I guess maybe because I haven't done a good enough job getting the word out. I think that's, at the end of the day, it's really just trying to get the information in the hand of folks who really need help. And, you know, that's on me, it's on us, it's on my specialty to really let folks know that there are options, that you don't have to suffer. I mean, you know, we can't solve every problem that's out there, but we can do a lot of good for most folks, which is, it's a big deal. And to not know that is, I think that's where people just sort of say, oh, you know, either they don't know it or they've tried and they've gone somewhere and it just hasn't worked out, and that's unfortunate.
Yeah, so it's your fault.
Yeah.
Just
it's my fault.
We established that.
It's my fault. If somebody doesn't know about, I guess I'd say, if somebody doesn't know about the options that we have to offer, that's my fault. I'll take the blame. So, yes.
But here's the deal. They go to the doctor over and over and over. They're getting medications. They're getting all these, and usually it's more pills you're getting thrown at you, whatever. So what makes you guys different than going to the regular doctor's office?
You know, I think the core concept there is we look for solutions. So it's not, we don't want to put a Band-Aid on an issue. We really want to get to the core of what's going on and what can we do about it. If somebody has nose and sinus issues, it's always one of two things. It's either the anatomy is shut down, so there's just not enough space in there, either in the sinuses or the nose, or that the lining is messed up in some way. It's irritated, it's unhappy. Those guys go hand in hand. A lot of times, swelling on the lining can cause the anatomy to shut down. An anatomic shutdown can cause the lining to be unhappy. So it's really just trying to disconnect that. It's that simple. And so if it is that simple, there are options to come after the anatomy, there are options to come after the lining, and it's choosing appropriately. All the options that work on the lining are made better if things are open, and vice versa. If things are shut, all those options that sometimes are very good aren't going to work for you if things aren't open. It's that simple.
Well, when you talk about all these different options, and I know it's important to you that people understand what you're talking about when you explain the different options and they're thinking through it. How do you think, though, that, because oftentimes you want a doctor to just say, this is what you should do, but you're reluctant to do that because you really want people to understand what's available to them and what might be some good things for them to consider.
Yeah, I mean, our role is to figure out what's going on and then really offer, these are the possible options. And it's not just sort of sit on a platter and then, you know, we walk away. It's really, okay, these are the things that might help you. And sometimes it's combining those things, but sometimes it's really just, where are you coming from? Some folks want nothing to do with anything procedure-wise, and you know, if that's appropriate for them, you know, which is, it's always your choice as far as those sorts of things, fine. We can try to work around that, and vice versa. Some folks really want, you know, sort of, if I can get something done, get it done, and that's fine too. And a lot of times those things can work hand in hand. If somebody's making a sort of an unwise decision, that's still their choice, as long as they've heard. For me, it's as long as we know what's going on, as long as we've explained it fully, and as long as you know these are all the options that are out there, then really it's on you, up to you, what's the right fit for you, and everybody's different.
Well, that's what I was going to ask with chronic sinus infections in particular. You know, I imagine that it's not just a one-size-all-fits treatment. You really got to kind of go through things. But what are some of the options if someone's having this chronic problem? You know who you are because you have it every year.
Yeah, I mean, the thing that I think, there are lots of different options. Anatomically, I think that's where we excel. So we can do sort of the most high-tech advanced procedures that are out there. That's great. There are also low-key in-office procedures that are out there. Balloon sinuplasty is one of them, where we basically use a balloon up in the sinus areas and expand those spaces. So simple in-office, something that you can, you know, really keep up and running. So that's a nice fit. So if somebody has that anatomy issue, we don't necessarily have to go all the way towards surgery, and sometimes we can do things that are short of that. And then vice versa. If somebody has major anatomic issues that, boy, we really need to go towards surgery, you're in good hands either way. That's nice. And that's really, you know, I think that gives us the confidence when we describe these options. We deliver all of them. And so if there's one that's right for you, you don't have to wonder, well, you know, is there something else out there that I'm not missing or haven't heard about? You're going to hear about it. it, and if it can be done, we can do it.
I think a lot of people worry about procedures or treatments, even if they hear that it's minimally invasive, thinking it's going to be painful, or thinking that the downtime, that it's going to be a long recovery.
Yeah.
That's not so much the case.
No.
And I love the fact that you've had some of these procedures yourself.
So I walk the walk, I talk the talk. I've done all these things that we talk about. You know, I've had them done, and I'm still here. I'm still standing.
And you got relief.
And I got relief, and that's the thing. That actually, you know, that's the thing that kind of makes me want to get out and let folks know, because I've been there, and I've been on the other side of the fence. I've been on this side of the fence. This side of the fence, the grass is a whole lot greener, and it's really just trying to, you know, sort of herd folks over. Okay, we can do this, and get them to a point where, you know, it's a big deal. If your quality of life is impacted, you know, that's your life. I mean, obviously you only live once, and so day after day, week after week, year after year, there's no need to suffer. And so if we have solutions, we should let folks know, and we should be able to get it done.
Yeah.
You guys have this free public program where you're going to be talking about the balloon sinuplasty and other sinus treatments right now. So people can come in on the 24th or the 26th, on Tuesday the 24th at 6 o'clock at Advent in Wauwatosa, right on Mayfair Road. You're going to be holding the program there. It's a private one-on-one meetings with physicians. You'll be talking with the audience members as well, but all the experts will be there. Then on the 26th at 6 o'clock, it's at your Advent location in Mequon on Port Washington Road. Here's where you register. You can go to advent.md/event-form or call at 414-771-6780. And you guys are located again right in Tosa and on Mequon Road in Mequon, on Port Washington Road as well. Advent.md is the website for more. But stop in on one of those free presentations. I think that's great.
Absolutely.
To learn a lot
It's a
more.
great time to learn.
Yeah.